Do y'all know someone who has or has had skin cancer? If so, do you know the pain and suffering that me and my family went through? Hello, my name is Vernon Johnson. Today, I'll be discussing the most serious type of skin cancer, which is melanoma. My mother, Tracy, had an abnormal mole that grew on her face. She took it to the dermatologist to get it cut off to check to see if it was cancerous. During this time period, while we were waiting on the results, it was a very hard time for me and my family because we were expecting the worst. We got the results back a few weeks later and learned that it was benign, which is non-cancerous. For this speech, I gathered information from scholarly articles to educate myself about melanoma. According to the health guide from the New York Times, cancer, melanoma, is a growth of abnormal cells in the skin. Melanoma starts as a mole and then turns into one of the most deadliest types of skin cancer. Today I'll be discussing the different factors of melanoma, such as what it is, the causes, capability of seeing it with the naked eye, preventative measures, and treatment methods. Melanoma is the most serious type of skin cancer. According to the article from Melanoma Skin Cancer Health Center, melanoma can affect your skin, can affect your bones, and every other organ in your body. It is the leading cause of death when discussing skin cancer. A problem most people have is they do not catch it early enough. Since melanoma is very fast and an aggressive cancer, people must find it early enough to have a chance to fight it. Melanoma can be broken down into two syllables: melanin, which is the pigment in your skin, and oma, which means tumor. Melanin is composed of melanocytes, which are skin cells. According to Wikipedia, melanocytes are cells that produce the dark pigment in your skin, which are responsible for producing skin color. Melanin is used as a protector against harmful UV rays, according to melanom.com. This type of cancer is found mostly in women rather than in men, especially in fair-skinned women. Since cancer is serious and should not be taken lightly, people need to know the signs and symptoms and what to look for. Dermatologists are not sure of the specific causes. However, they have narrowed it down to being genetic and environmental causes. The leading cause, according to Mercola, are said to be tanning beds. Although catching melanoma such as places as your mouth or abnormal places, doctors are not sure of the different causes for those. Melanoma can be seen with the naked eye. It appears as an abnormal mole with a different color and different size than usual. Medline Plus has an easy way for patients to track them and to see abnormal moles on their bodies. A, which stands for asymmetrical, the shapes are different. And they do not match each other. B is for the border. The edges are ragged, irregular, sometimes blurred. C, if any, is for color. Uneven, and they may include shades of black, tan, or maybe brown. D, which is for diameter. There's a change in size, and melanoma usually causes them to become harder. If someone is curious about a mole in their body, they need to get it checked immediately. There are several different treatment methods that doctors can use for different patients depending on who they are. According to the Melanoma Health Center, your doctor thinks that you have melanoma. He or she will remove a sample tissue from your body, which is known as a biopsy. Another doctor, which is a pathologist, will look to see if the tissues are cancerous. If the pathologist finds that you do have cancer cells, they will do further testing to test your lymph nodes to see if the cancer has spread throughout the rest of your body. Even if the lymph nodes are not positive, one will still have to see an oncologist, which is a cancer doctor, for treatment of their conditions. Some preventative measures: stay out of the sun during the midday hours, which is usually from 10 a.m. to 4 p.m. Apply sunscreen, especially during higher elevations. And most importantly, stay out of tanning beds. In conclusion, I hope that I have informed you, and I hope you remember the causes, signs, and symptoms, preventions, and treatment methods. I have definitely learned the significance of checking myself as well as my family for any abnormal moles. Therefore, go get yourself checked out. Thank you for your time.